More than 1 million people in the United States have died of drug overdoses in the past 20 years, the majority from opioids, and there is no end in sight. Hello there, I'm Mike Walter, sitting in for Anna Naidu, and this is The Heat. The United States is grappling with one of its worst drug crises. More than 1,500 people per week die from opioid-related overdoses, a toll that has risen across the country during the pandemic. Opioid addiction has become an epidemic, endangering not only public health, but economic productivity and national security. And overdoses are now the leading cause of preventable death among people between the ages of 18 and 45. For more, we turn to CGTN's Sean Callebs. He's in our newsroom. So, Sean, break it down for us. How bad a crisis is this, and what can be done about it?
You know, Mike, you and I have talked about this. This is a horrific crisis, especially punishing that segment of the population, the young, 18 to 45. And those numbers bear repeating. 1,500 people a week, and this is something that could be avoidable. Now, in many times, an epidemic like this, it's difficult to trace the roots, but in this case, not so much. The Sackler family and their company, Purdue Pharma, really pushed OxyContin out, trying to get doctors to prescribe it. People who are having their teeth worked on were getting 60 pills. So what happened? Many millions of people got addicted to these. And so what happened, once they could no longer get prescribed the medication, then they would go out in the street and try to buy it. It's about $25 per pill. So after that, they then dipped into heroin, and then, of course, fentanyl made its presence known. And fentanyl, a synthetic opioid, is significantly stronger, many times stronger than a traditional opioid, and that has led to a number of deaths. And here's what experts have to say about this epidemic.
We are at a incredibly bad point where we have had the biggest increase in deaths in the United States and in Canada, I would add, in the history of either of those countries. Deaths going up more than a third in the United States in a 12-month span, going up by more than 2/3 in Canada. This is a very dark moment.
Yeah, it's just horrific. And knowing the problem and being able to trace it and deal with it, you think authorities would have some kind of hold on it by now, but that is simply not the case. And a lot of areas, I'm from the heart of Appalachia, and my hometown, Huntington, West Virginia, was one of the ones hit especially hard by this. I went back and did a documentary on hometown heroin. So many people I knew and grew up with. It really cut across every socioeconomic fabric within that community. Is just horrific. And the fact that it just keeps going on and on. Children are now being born to mothers who are addicted to opioids. And so children are coming into this world with all sorts of problems that are going to lead to the kind of problems that we're going to be taking care of for the next 40, 50 years. So it is really a horrific problem. Now, how to stop it? There have been settlements with the Sackler family, but what is that doing? Is that taking the problem away? Not really. This is something that is around and trying to find a way. Mike, from what I understand, the way opioids affect people, they kind of rewire your brain. So getting off this is so much more difficult than alcohol or cocaine or something like that. So it is just a horrific problem. I look forward to what your panel has to say.
Yeah, and Sean, stick around because I'd like to keep you involved in this conversation because you've been there on the front lines, seen what this has done and decimated communities, and we'd like to get your insights on that. We want to get to our panel. Harry Nelson is an attorney. He's also the author of The United States of Opioids, a prescription for liberating a nation in pain. Mike Vigil is the former head of international operations for the U.S. Drug Enforcement Administration, and Jim Hood is the CEO of Generation SOS. He lost his 20-year-old son, Austin, to a drug overdose in 2012. And Jim, I'm sure it's painful to talk about, but you obviously can never forget a day like that. Can you take us back to 2012, and what was that day like for you, and when did you learn the news?
Yes, it is. Thanks. It is excruciating, and every day it's excruciating. In our case, briefly, Austin had been through a 6, maybe almost 7-year journey with alcohol and weed and opioids and other stuff. And, you know, we did all the things that we thought we could and should do. Of course, there's no user manual. My wife and I were utterly lost. But the irony in our case is through all the ups and downs, he was suddenly doing considerably better and was excited about getting back into college and finishing up, going to grad school. His music had never been better than it was, and his optimism, it was back, and we all thought this was behind us, and then we got a call in the middle of the night, and as best we can deduce, and this happens a lot, is when people relapse, they think they know what their bodies can tolerate, but maybe you're just a couple notches less tolerant. And we lost a beautiful boy after a 7-year journey, and it's simply it's soul crushing. It changes your life.
It does change your life. It also changed the course of your life. As we mentioned, you're now the head of a nonprofit called Generation SOS. I was looking at your website today. It's obviously targeted towards young people. You want to save as many as you can. Can you talk to us about your efforts now and how this really did change the course of your life in many respects?
Well, sure, and it's thanks. It's not about me, but this thing is so life-changing. As I dug into it, and then tragically, you find out how common this is. This thing that we call stigma keeps all of this under a blanket, under a bushel, until you really dig into the numbers, as you folks have done, and you find out how common this is, how devastating this is. Touches 35-40% of American households. Either addiction or death. And so I just decided with friends, I wanted to try to do something about it. And you find out that the seeds of addiction are invariably planted during the teenage years, and horrifyingly, even early. It's an adolescent onset illness. So if we're really going to try to prevent it and not just treat it, and that's what Generation SOS does, you've got to start working with teens and preteens and try to go upstream and get at the root causes of the social and psychological and family issues that lead to substance issues. It rarely starts with substance issues. There's usually some other trauma.
Harry, let me ask you about your book. One reviewer said this about it. In the United States of Opioids, Harry Nelson offers a clear and comprehensive picture of how the opioid crisis emerged and the challenges in addressing it. So let's start there with the challenges in addressing it, because this has been something that's, as Sean pointed out, has been ravaging communities now for years. What are some of those challenges, and how do we address them?
Well, I think it starts with really understanding the crisis. I think that many of the narratives that we've been sold about the opioid crisis relate to bad behavior by drug companies like Purdue Pharma and physician inattention to prescribing in a more limited way, and those are true statements. But I think there are some real deep questions here that we have to understand if we're going to address the problem. One, I agree with the comments regarding shame, and there's a deep cultural piece to this in our culture. But I think a lot of it relates to a brokenness in our healthcare system in several ways. I think we often are really, in America, we're spending more on healthcare than any country in the world, and we're not getting very good care, and that extends both to we have a system focused on late stage intervention, and we don't put in preventative time to address issues around mental health. We don't provide the same mental health support that many other developed countries provide, and so we have a lot of structural deficits that are leading to a situation of enormous pain, mental pain and physical pain. And then you couple that with some deeper issues in American society right now that are leading to a real sense of hopelessness and despair. And you put that together with isolation, as our communities have broken down, as more and more people are living their lives through their smartphones and really having less and less community around them. That's the perfect storm: hopelessness, isolation, and pain. And that's what I think we need to start with, is understanding how do we tackle those things if we're really going to make a dent in this horrific crisis.
Yeah, and maybe we can talk a little bit more about that. But Mike, I want to bring you into the conversation because you were there on the front lines as the head of the DEA's international operations. Now, earlier this month, authorities discovered a sophisticated drug tunnel. This tunnel went from Tijuana to San Diego. It came complete with a rail system, meth, cocaine, heroin seized. There have been similar discoveries in the past. I know that you've been involved in projects along the way. Does interdiction work?
Well, the thing is that interdiction does work, but keep in mind that it's not going to stop all the drugs from coming into the United States. You can have successful interdictions, which have occurred on the border, seizing tons of fentanyl and other dangerous drugs. But here's the issue, that until we curb the demand for drugs, it boils down to the basic law of economics, and that's supply and demand. As long as we have that demand, if it's not Mexico, if it's not Colombia, it's going to be another country. So I believe that we have to do a better job, as one of your individuals stated, in terms of educating the youth of America. And, it deals with the families, it deals with the schools, it deals with the church. But as far as I'm concerned, we need to educate the kids from a very early age. And I would propose that, drug, the issues with drug abuse, the demand for drugs be part of the school curriculum across the United States. So the other thing is that we need to do a better job in terms of treatment, because we do have treatment facilities throughout the country, but most of these treatment facilities, what they do is they detox the individuals, and then what happens, they go back to the same neighborhoods. A lot of times there's not any follow-up. So they're back on drugs within a couple of weeks. So there's a lot of fixing to do in terms of this crisis, and this crisis is getting pretty bad. Within a 12-month time frame, we lost over 100,000 people, and with the period ending April of 2021, and that was an increase of 28.5% from the previous time frame.
Right.
And here's another statistic that is going to floor you, is that the United States consumes between 80 and 85% of the opioids that are produced around the world. If you add Canada and a few European countries, that goes up to 95%.
Wow. Wow.
Which only leaves 5% of the opioids produced on the planet for the rest of the world. So that kind of gives you an idea of this huge problem.
Well, and I think it gets to the heart of what we were hearing from Harry just a minute ago, and I want to talk to Sean about that, because you've been to your old hometown where, a lot of jobs have been shipped off, this hopelessness, despair, isolation that he described, plus adding COVID with lockdowns and people feeling isolated. That really is a recipe for disaster, and I think it's something that you've seen in these communities, haven't you?
Yeah, really. If you think about so many of the areas that are really hit hardest by opioid addiction, they are areas where they depend on blue-collar jobs. Where I'm from, it's coal, rail, steel, things of that nature. So when people suffered injuries early on, instead of going to rehab, instead of trying to get better, they were given Oxy and say, you can go back to work. And of course, they had that initial high, like, wow, I'm better. This is a miracle drug. And then the reality kicked in, and he realized just how addictive it was, and how the doctors and the people who had been addicted to opioids talked about it, how it rewires your brain, and it's just so difficult. I think that what someone talked about just a moment ago about treating people in these facilities, they get them clean, and then they put them back out on the streets. Well, it doesn't take long before they run in with the same crowd, before they have the old cravings, and then they dip back in, and if they can't get Oxy, then they'll get heroin, and they don't know if that's been cut with fentanyl. And one really tragic story that I came across, somebody who gave me my first job, he worked at a hospital in my hometown. His son, now that gentleman's son, then got addicted to opioids, and he'd gotten clean, and he went back one more time, and he had been used to shooting up with a certain dose, and he'd been clean for like 90 days. So when he gave himself a stronger dose that he had been doing before, he OD'd, and his family found out. His mother was a counselor at a school. It's just horrific. And then trying to cope with that and deal with that and move forward, these are people who believe they did everything right. They raised their children correctly. They were good students. They were smart. These parents had wonderful jobs. So what happened? It's just that addictive spell that's basically cast over people, and talk about it, the fact it does hit you in adolescence, and then trying to get out of that, it tends to follow people for years and years and years, and those are the ones who try to beat it. Too many people at the $1,500 a week just lose.
Yeah, Jim, it's just terrible news. Sean, thanks so much for your insights. I'm going to cut you free because I want to invite Dr. David Gastfriend to join the conversation. He's an addiction psychiatrist and chief medical officer of Dynamicare Health. David, thanks so much for joining us. You know, let's talk about that because I think there's so much stigma attached with drug use. There's also, and maybe we can bring Jim in after discussing this with you, but Sean mentioned, you know, these parents feel like, geez, I did everything right. You know, there's also this kind of stigma attached to parenting, like, what did I do wrong? How did my kids end up on drugs? Can you talk about some of the things you see as you talk to people who are addressing this menace?
Yeah, I've talked to many parents and loved ones who've suffered these kinds of losses as Jim has. You know, this series of drug overdose waves, we're in our fourth wave now, not our first, has changed the way society views addiction. There's much more acceptance and awareness that anybody can be vulnerable to addiction under bad circumstances. And those bad circumstances, you know, they started in wave one with prescription opioids when someone had a surgery or an injury and was excessively prescribed these things. The second wave was when doctors got scared and pulled away the opioids and people turned to heroin. That was already by 2014. The third wave is now fentanyl. In 2019, we saw this rush of this high potency, artificial or man-made drug rushing into the US and other parts of the world. And we're in the fourth wave now where stimulants are being added to these, cocaine, methamphetamine, and more potent amphetamines. So there's much more societal awareness and acceptance and willingness for legislators to put money into the effort.
Jim, I do want to talk to you about what Sean brought up, you know, this thought that as a parent, somehow you're responsible for the choices your child makes, and geez, what did I do wrong? What could I have done differently? And I know I've listened to your story, and you tried everything in the book. I mean, it wasn't like your son was isolated. I know that you've talked about how you texted every day. I mean, you tried everything. So can you talk about that from a parent standpoint, just how you beat up on yourself and, you know, you question, geez, what could we have done differently?
Well, you do beat up on yourself because it's probably the greatest pain, they say, that any human can endure is the loss of a child. And I don't give us any particular high stars. You know, we did try to do all that we could do. But as I look back and what I've learned along my journey is I don't think I was able to understand the depth of Austin's loneliness or his isolation. He had difficulty articulating it, and there are probably other elements. But we hear this from so many of the kids we work with now at, you know, Generation SOS, and I'm alone. I'm a loser. People don't understand me. I'm the only one going through this. And I don't remotely mean to make light of it, but there is something peculiar if you have a whole room full of people saying, I'm alone. I'm the only person who's alone. I'm the only person who's disconnected. Nobody understands me. Nobody knows what I'm going through. They're all saying the same thing. So a lot of what we try to do is it's almost pre-therapy. We get them to start sharing their stories, finding commonality between each other, and that really starts to break down the stigma and start a conversation so we can drag this thing out of the closet. You know, people, and hello, David, people much smarter than me will say the stigma that surrounds substance misuse, addiction, and all the rest today is analogous to the stigma that surrounded HIV/AIDS now 30, 35 years ago, which is not a good thing. But the problem we're talking about now is, depending how you measure it, it's 25 or 30 times larger than HIV/AIDS was at its peak. I mean, this is a bona fide crisis, and to a large extent, we still ignore it. It just never gets to the top of the news stack, and we've got to change that before it steals a generation of our kids.
And Jim, we're also seeing overdose deaths among teens doubling in the past 3 years. The National Institute on Drug Abuse saying they're more likely to take pills like Adderall, Xanax, or Percocet. Sometimes they're using it to study for exams, deal with anxiety, or trying to get sleep. They might get it at a party. A friend might give it to them. Can you talk to us about this trend that also, as you said, it's not getting a lot of attention?
Well, you're right, and I could bore you to tears with statistics. There is something going on. This is a uniquely American problem. I will say that. Although it's interesting, I noticed that your network did a story just maybe 4 or 5 days ago about China's adolescents are struggling with mental health issues. It doesn't yet manifest into massive substance misuse problems, but there does seem to be something going on globally with kids, with teens and young adults just feeling massive pressure and inability to cope. But a couple of your guests have mentioned tonight, and I can't make enough of it, fentanyl is a game changer. And with respect, I'm not sure enough adults or enough parents really understand that. Fentanyl is now the leading cause of overdose deaths in America. And the thing about fentanyl, and you have to be careful with your words, we do not condone any drug use, but we don't preach abstinence because you lose relevance with the kids. But you could have, you do have kids who, medically speaking, do not have a chronic, substance issue. They're out partying. They might do something that you don't think they should do, but they don't do it 3 times a week. They might do it once a month, once every 3 months. It could be smoking a joint, which generally speaking has not been addictive over the years, but if they smoke a joint with fentanyl, they're likely going to die. They don't know that. Parents don't know it. Society doesn't know it. So these weapons of mass destruction are getting more and more horrific, with the passage of time, and we need to educate our kids and educate our parents.
David, talking about educating kids, educating parents, when parents or the kids come to you, as he said, this is a real serious problem out there. What are some of the things that you guys talk about?
Yeah, well, another terrible problem in the United States is an almost complete lack of treatment facilities for adolescent substance use disorder. Insurance companies are supposed to cover this, but they don't have the adequacy of care providers in their networks. So there's almost nowhere for parents to turn once they identify that their kid is at such risk. So parents have to realize that a kid can go to a party, as Jim was describing, try something for the first time, and that actually can kill them. It can put them into a coma. Kids can think they're just going to sleep it off in the corner, and the next morning they're cold. So parents need to talk about this with kids, to say, look, you need to understand there's stuff out there that's deadly, that your friends don't understand, and we love you. There can be all kinds of problems in the family and relationships in your life. None of that should involve taking a risk that could end your life. And then it's very important for kids who do get access to treatment to understand that there are small incremental steps that can be taken to get well. It's not all of a sudden a kid has to sign up for AA or Narcotics Anonymous and promise to live a life of total abstinence. That is overwhelming, and it turns kids off. And so we need different approaches where kids can use techniques that give them rapid, easily obtained, frequent wins, so that they can feel like, well, I could do this, and have a sense of accomplishment.
Yeah. Well, Mike, let me ask you about this, because it seems like for the longest time the U.S. had this kind of war on drugs mentality, and interdiction was a big piece of it. And yet we hear from every guest that's been on here, it needs to be much more of a holistic, comprehensive approach. Was that the wrong move?
Well, The thing is that the United States, for a number of years, has put more emphasis on supply reduction. But again, I think that the other two pillars that have to be focused on is treatment, good, solid, comprehensive treatment, and then also, education. But let me tell you something that's very important here that hasn't been mentioned. One of the main reasons is that we're seeing a lot of people dying from fentanyl is because the Mexican cartels, primarily the Sinaloa cartel and the Jalisco New Generation cartel, are lacing other drugs with fentanyl. They're lacing methamphetamine, marijuana, cocaine with fentanyl, and the users here in the United States have no idea that fentanyl is being injected into their drug of choice. So that's one of the reasons that we're seeing a lot of fentanyl-related deaths. And fentanyl is 50 times stronger than heroin, 100 times more stronger than opium. So a few milligrams, 2 milligrams of fentanyl can be lethal to a normal human being. The other thing is, we talked about West Virginia. The Jalisco New Generation cartel is now moving into rural America because it's an untapped source of revenue. So we're going to start seeing a lot more deaths in the rural areas.
And it's already a serious problem there already, Mike. Let me ask Harry, I've got to ask you this question about, does the FDA have a role here? And, there's been so much talk about this revolving door where folks work for the government, then they get jobs in the pharma industry. Does there need to be some kind of changes there as well? Harry?
Yeah, no, so there are issues at the FDA, but I just want to say there's a bitter irony in this conversation that really we can thank the DEA and the state medical boards for basically pushing people off of prescription opioids, whatever problems there were, into a much more toxic drug supply on our streets. So the FDA, absolutely, we can definitely lay some of the responsibility at the foot of the FDA for not policing drug companies, for basically allowing drug companies to peddle highly addictive drugs without really giving warnings to physicians and to patients. And we have a long history of that, but I really think it's missing a bigger point here, which is just that, we've got a problem. We keep talking about how are we going to manage the supply of the pills. The real problem here, when we talk about a 20-year opioid crisis or a 22-year opioid crisis, we're missing a 50-year cycle in American life where year over year more people have died of overdose deaths. So the problem is not opioids. The problem is, why are more Americans taking risks with their lives, and choosing to end their lives, or more commonly, accidentally dying?
We've run out of time, but you've posed a really important question, and hopefully we can pick up on it at a later edition of The Heat. I want to thank our panelists for joining us. That's it for this edition of The Heat. I'm Mike Walter, Washington, D.C. Thanks for watching.